A key focus on Full Measure and some of our most popular stories surround our off-narrative reporting on health issues that are often not well covered or fairly covered elsewhere. In Season 10, we reported on the seriousness of the mysterious epidemic of low testosterone in American men. But scientists say there's no doubt that male hormone levels have shrunk in recent decades. And we're not talking about common age-related decline. Men in their 40s today, on average, have significantly less of the male sex hormone than their fathers did when they were 40.
So the data are actually pretty clear that testosterone levels are declining over the last 50 years or so.
Can you give us in a time frame of what we know or what the estimates are?
Well, it depends on the study, and there have been several, but it ranges anywhere from 10 to about 20% testosterone over the last 40 to 50 years.
So what age? Let's equate that to a man.
So most of the studies are not in younger men, actually, but middle-aged men.
As Americans find themselves let down by the medical establishment, they're looking for ways to find their own way to get healthier. The government doesn't always like their choices. We reported on the government food police cracking down on farmers and distributors of food that some consumers are seeking, viewing them as safer and more natural. Nestled in the gentle hills of Brandywine, Maryland, is P.A. Bowen Farmstead, where owner Sally Murrow sells cheese, eggs, and most importantly for the purposes of this story, raw cow milk. Is all of the milk that you sell unpasteurized?
That's correct.
Is that what raw means?
That's what raw means.
Today, a debate rages over which is healthier and safer, raw milk or pasteurized milk, and what rights the government has to limit the choices of farmers and consumers. A flashpoint in the debate can be found in the heart of Pennsylvania dairy country, where a fifth-generation Amish farmer has drawn repeat visits from the food police.
They want to make him an example so they can have complete control over our food supply in America.
We were on the leading edge of reporting on the dangers of and controversy over artificial food dye, which is now in the crosshairs of Robert F. Kennedy Jr. at the Trump Department of Health and Human Services, and also the subject of state action absent a federal ban. Before she became a parent, Erin Seradian says she didn't give much thought to food coloring.
So funny, like 15 plus years ago, my sister-in-law, we were visiting them in Texas, and they made a comment like the kids can't have anything with dye in it because it makes them hyperactive. And my husband and I, at the time, we weren't married, we were like, oh, okay, you know, they must be crazy, like that's not a real thing.
Years later, when they had their own son, Jack, it no longer seemed crazy.
Every time he had anything with dye in it, he had the hardest time focusing. He was more irritable, cranky, angry, and you would be surprised about how many food products contain food dyes.
Besides health, we've always had a special interest in whistleblowers, too often ignored and controversialized by other news organizations today. An important case in point is the Merck scientist who blew the whistle on shenanigans over the company's MMR vaccine, alleged doctoring of study data, and FDA concerns about the amount of virus in the shots. So the MMR vaccine is one of the vaccines that contains live virus. Not all vaccines do, but this functions, if I'm stating it correctly, with some live virus in it that triggers an immune response or whatnot.
Yeah, all three viruses are live viruses.
And there's a limit on both ends of how much has to be in there, but no more than whatever for it to be safe and effective.
So the problem was that these viruses degrade over time, and Merck had to calculate backwards and say, we need to add more virus so that this stuff doesn't degrade, because the FDA was adamant. You cannot keep distributing that vaccine if it's out of specification. They had to do this thing called an overfill, which is the same as if you take a glass of water and pour a lot into it till it overfills. They added more virus, vaccine virus, to the vaccine for measles, mumps, and rubella.
If there's too much live virus in a shot, what are the sorts of problems that could occur? That's a potential safety risk?
Of course.